Dear friends, so I'm happy to welcome you to the second day of our seminar. And today is also the Russian Orthodox holiday in Russia. So today, first we will, Dr. Ram will answer the questions from our online listeners that we received yesterday and some today. And then maybe those who are here in the room also have their questions that they would like to ask about the yesterday's topic. Then Dr. Ram will talk about management of diabetes in Ayurveda. And at the end, we will also leave some time for, again, your questions. Maybe you have specific questions about your patients that you would like to ask, or about the topics that we discussed. Dr. Ram, so I will read the questions now.
Yes.
First in Russian and then in English. So, Dr. Ram, yesterday you said that in Kapha type of Vata Rakta, sometimes you use pindas with powder and maybe dhara. The question, should you warm the pindas in oil first, or do you use them dry?
Yes, so these pindas are used dry when kapha is extremely dominant, and also when there is more of mellitus in the body. And also when there is much of ama, oil cannot be used. But in this rheumatoid arthritis, when there is dominance of vata, we may use it in a dry way. But otherwise, we always do the pindas by first heating in oil. So it's based on this principle that all treatments are decided whether it's suitable or not. The dosha, the ama, the dhatu that is involved, then the stage of the disease. So it's extremely logical. So you just need to check if there's too much of kapha, mellitus is involved, and there's a lot of ama, then we cannot do with oil. And we'll have to do dry pinda. If these three conditions are not there, and if it's only kapha, and in rheumatoid arthritis there is also the involvement of rakta, and so too much of dry heat cannot be used.
So with the same state, can we use like rubbing with dry powders as well as udvartan, massage with powder, in order to increase mobility?
Yes, the answer is quite similar, because specifically udvartana, which is rubbing with dry powders, is indicated when kapha and mellitus are coming together. Mellitus is the fat, because fat can only be burnt by the body, cannot be removed by any cleansing. And this is a treatment for obesity. Udvartana is a treatment for obesity, but it is generally not used in rheumatoid arthritis, as it can. Yes, I mean, it's kapha and mellitus when they are dominant, and especially for mellitus, udvartana is very important. In rheumatoid arthritis, we should avoid it because it's very harsh, and on the joints, you have to be very gentle with the rheumatic arthritic joints. So I wouldn't recommend using this in this condition.
Dr. Ram, how do you feel about using absorbents, in particular clay, in order to decrease toxins or ama in management of musculoskeletal disorders and diabetes?
I mean, the first thing is that ama is often wrongly translated as toxin. Ama is not toxin, because toxins in the body can create an emergency. Toxin is poison. I would translate ama as bad chemistry. It's bad biochemistry. And we have to correct the biochemistry in the body. There is no toxification. There's no toxicity in ama. So what we are doing in ama is correcting the metabolism. It's not, removing some things through a physical process of adsorption. Yeah, it's not like mopping and removing toxins or waste from the body. When you treat ama, you're correcting metabolism. Ama means stoppage. The word ama means to stop moving. It means the biochemical processes in your body, which are happening in cycles, they suddenly tend to slow down or stop, and then there is a stagnation. It's kind of a chemical stagnation. It's a failure in transformation. So the key treatment for ama is to bring back the transformation. This is called as pachana. This is very important. We are reactivating the metabolism, optimizing it, and then what needs to be removed from the body will be automatically eliminated. So there is no special poison in the body that we have to remove. So for that reason, we don't believe just by keeping some adsorbents in the stomach, all the toxins will come and be removed. We have to work with herbs that correct metabolism. Even by simply doing purgation, laxation, ama is not removed. It's only by correcting the metabolism.
And one more question from our listener from Malaysia. What is the cause of TMJ and how to treat them?
Yes, I mean TMJ, which is said to be dysfunction of the temporomandibular joint here.
Let me translate in Russian. Проблемы с
височно-челюстной,
да,
the jaw, I mean the joint here. Yes, that is the condition, and the causes are not really well established. It is said to come as an outcome of trauma sometimes, or it can be also due to muscular problems. If you look at the symptoms, we can see vata and pitta are involved, because there's tenderness, then sounds from the temporomandibular joint and difficulty in opening and closing. So there are clicking sounds when you try to open. So these are signs of vata. So in Ayurveda, we don't worry about names of the diseases, and we just look at the presentation. What we need to know is what is the dosha involved, whether there is ama, whether there is structural damage, as I said, and then treat according to the dosha. So in the first stage, we would probably, because there are slight variations in the presentation of, as I told yesterday, even in the case of rheumatoid arthritis, it's not all the same for Ayurveda. So we would first individually assess the patient for what is the type of dosha. And generally in these conditions, we need to do some lepas, which is, herbal pastes to clear the channels, and then do abhyanga and swedana. Yes, the TMJ has also been said to be caused by psychosocial factors, stress. So it's not well understood how. Some people have a predisposition to develop this condition. So here again comes the Ayurvedic idea of prakriti, the mind-body relation. So these are additional elements which we will look into for each patient to find what is the background, and then we will have to treat. So first these lepas, we have to open up the srotases first by clearing any congestion, and then we do repeated sneha and sweda, and some nasya medications, because through the nose it corrects the vata in the whole head region. These would be the general indications that I can say, but this would be very patient specific ultimately, but this would be the overall line of treatment. Because we have to stabilize vata in this region, and if we need later, we may do other treatments for vata like pichu, keeping cloth dipped in oil in the center of the head. A lot of people get headache when they have this problem. The scalp muscles become tight, and so in the last stage we can also give gentle facial and scalp massage to, bring back harmony of the muscle.
One more question just came from the same listener, and he's asking, what about marmotherapy for TMJ?
Yeah,
TMJ.
I didn't go into that, of course. That's very specialized, and it is one of the marmas and special marma procedures which can be used, but this had to be done by an extremely trained expert in marma. So that would be definitely very helpful in stabilizing water. And as a principle, marma therapies are never taught in short seminars. You need, really hands-on, personal training to make sure that, you don't do it in the wrong way. So that's why I didn't go into, but it's true. You can, a lot of benefits you can get from marma therapy. So today, more relaxed because we have only one disease to discuss about.
Сегодня будет немного более расслабленно, потому что сегодня у нас есть всего одно заболевание, о котором мне нужно вам рассказать.
Because yesterday was musculoskeletal diseases, which is not one condition. You can have diseases under musculoskeletal. So it was much more challenging to try and give a comprehensive overview. Today we are focused only on diabetes mellitus. So this is just a very quick review. I mean, I'm not going to read much. This is the modern aspects, but just to refresh and pinpoint some of the areas where I will be focusing. We'll run through some slides.
У меня здесь есть некоторые слайды, где такая техническая информация. Я сильно не буду в это углубляться, так быстро пробежим по некоторым моментам, чтобы напомнить себе.
So, I'm not going to describe the allopathic elements, but to highlight some of the understanding today so that, we can then relate it to Ayurveda in a better manner. See, today, general thinking about diabetes is high blood sugar, but that's just the tip of the iceberg.
Но это всего лишь верхушка айсберга.
It's only a superficial manifestation. And that's why Ayurveda did not give that the primary importance, although it was necessary to look at blood sugar. We know that the reason why there is high blood sugar, there's a lot of events that have to happen before hypoglycemia develops. And, the key focus is on metabolism again, fat, carbohydrate, protein metabolism, and then the failure of insulin. These are underlying events, which in Ayurveda is again related to Agni and Ama. Yeah, it's Agni and...
No, in modern.
In modern, yeah. So underlying diabetes is related to disturbances in fat, carbohydrate, protein metabolism. So in Ayurveda, you can see our focus has been more on the metabolic aspects of diabetes than just the superficial manifestation of high blood sugar. We've been always focused on the causes, the background. And the second thing is the long-term effects of diabetes. The microvascular complications leading to multiple organ failure. Microvascular is the small blood vessel, capillaries and, small, yeah. So what I was saying is in Ayurveda, this modern understanding. High blood sugar is one part. We forget that in Ayurveda, we look at one, the background, carbohydrate, fat, protein, and the other is the damage that diabetes can do in the long run to many of your vital organs like the kidney, the heart, the brain, the eye. So in our discussion on Ayurveda, we are also going to mainly focus on the metabolic aspects of diabetes in terms of Agni, Ama, and then what this build-up over a long can damage your organs and what we can do to prevent it. And Ayurveda also says that diabetes should be diagnosed early in an indirect way because the diabetic specific symptoms may take a long time to manifest. So it's already quite established when diabetes is diagnosed. Is that what is written here? Yes. So,
Yep.
So this is the key thing that Ayurveda says, that we have to catch it at the pre-diabetic stage. There's actually a very long pre-diabetic state which is unknown, but which we can identify through the metabolic and, as I told, the Agni Ama disturbances. Looking at it from an Ayurvedic viewpoint, I hope that in the near future there would be other measures rather than blood sugar which would be used to diagnose diabetes. Because Ayurveda says if blood sugar has increased, then it's already too late. So to diagnose diabetes as on the basis of just blood sugar levels is a very pathological approach, not a preventive and proactive approach according to Ayurveda. So there are many pre-diabetic events related to fat metabolism and, you know, the other metabolic pathways, which probably in the future maybe certain specific events could very specifically predict, you know, diabetes, and that would be a real breakthrough. And here I think the concepts of Ayurveda will give very interesting light even to modern science on how to, you know, do this early detection and diagnosis. And so on the one hand, Ayurveda is focused on pre-diabetes, early diagnosis, and once you have diabetes, then Ayurveda is focused on the long-term effects. It's more concerned about what will happen afterwards. So if you look at the long-term effects, I mean, this is really frightening, and there are a lot of approaches in Ayurveda which is focused on preventing these long-term effects, you know, such as retinopathy, which can lead to blindness, nephropathy leading to renal failure, and then neuropathy, and then many other conditions, you know, leading to even amputation. I mean, the diabetic foot, which is a nightmare for diabetic patients. So we know diabetic patients need to be very careful about cardiovascular. And so now to say that when we go into the treatments, the strength of Ayurveda is in the early pre-diabetic stage, you know, very quick detection and preventing the processes from developing into full-fledged diabetes. And once diabetes is established, to really help to prevent these complications. So these are the two real, you know, strengths of Ayurveda. So of course, this is very disturbing, the burden of diabetes and the rising increase. So I just wanted to highlight that it's high time we diagnose diabetes in a pre-diabetic stage. I mean, no longer can we afford to wait till diabetes is diagnosed by blood sugar levels. I mean, it's becoming a pandemic. Okay. So now, just a quick look at the types of diabetes, because this is just to contrast and see how Ayurveda classifies diabetes. So, like in modern medicine, you have pharmacological approaches which are basically targeting insulin and glucose uptake, you know, regulation of glucose uptake, and modulating and fine-tuning insulin, you know, activity. Yeah. So I said, you know, and also working on insulin, you know, insulin sensitization, or, you know, insulin secrete or insulin replacement. And of course, pharmacologically, the whole focus is on maintaining glucose levels, you know, within certain limits. And now, of course, there are other parameters also being emphasized, like dyslipidemia and weight, and, you know, other parameters also. So I have to tell the limitation of Ayurveda here. Two things which is really to the credit of modern medical system, without which people would have died like ants. One is the anti-hyperglycemic agents, which can bring down blood sugar to safe levels, and hypoglycemic agents, and then insulin replacement. These are two, you know, discoveries that completely revolutionized the way diabetes is handled. And there's no parallel in Ayurveda. These were limitations of Ayurveda. But the other aspects of diabetes is where Ayurveda is really strong. So we will look into those elements. So we know about type 1, type 2. It's very well discussed. But there are also some other types like gestational. And then now the new terminologies are emerging called LADA and MODI. MODI, of course, not our Prime Minister. And then also there's secondary diabetes mellitus, caused, as a sequel of other problems. So here's type 1, which is comparatively less common. Genetic, autoimmune, and environmental factors are behind this. So here what I want to say is that Ayurveda was the first medical system in the world to classify diabetes into the inherited and acquired. The type 1, type 2 clinical presentations are described in the classical texts many centuries. They are the earliest records of. So Indians were eating a lot of sweets even in those days. So even the modern terminology, diabetes mellitus, is a translation of Sushruta's term madhumeha, honey urine. So while type 1 diabetes is comparatively of lesser incidence, type 2, which is acquired by bad lifestyle and diet, is the more, this is in Ayurveda, these were called as the Krisha pramehis and the Sthula pramehis. They cannot be translated.
Okay.
So easy to translate.
Can you repeat, because I didn't remember the Indian one?
Yeah. So the Sthula pramehi means the obese diabetic, and Krisha pramehi means the thin diabetic. So they used this imagery in those days to differentiate type 1 and type 2. So you can see obesity is a risk for type 2 diabetes. Now these terminologies are changing. It was earlier known as early onset, late onset, but now type 2 diabetes are also seen in children and adolescents because of our wonderful lifestyle. So these terms are no longer relevant. Okay, so there are many technical things, but I will be just going through that very quickly. To understand Ayurvedic approaches to treatment, these concepts are important to know. The difference between insufficient insulin and insulin resistance, because it's described in Ayurveda. And it's not described in Ayurveda. Where would it come in Ayurvedic terminology?
Insulin function is related to kapha function.
Yes, but it is actually related to Agni. Because the result of insulin dysfunction is ama in the body. Because something which should be utilized, transformed, the glucose the function of insulin is to enhance glucose uptake, to burn insulin, to facilitate the burning of insulin. So it is coming under Dhatu Agni. Dhatu, Dhatu. There is Agni in the Dhatu and there is Agni in the Jatara. So first thing I said was that insulin is related to Agni. Why? Because Agni is that which helps to transform. And the glucose, when it is not utilized, it accumulates, and that is ama. So glucose is not a toxin. That's why I said glucose, ama is not toxin. It's unutilized, half cooked, half. So diabetes is a good example. Yes, because the glucose, that's why I mentioned that ama means a break in the metabolic pathway. The glucose, which should actually go through another cycle of transformation, is unable to do so because insulin is not functioning. So, Agni in Ayurveda, we have Jatara Agni, the digestive fire in the stomach, the alimentary tract, which works on food. Any Agni that works on digested food is Dhatu Agni. And in diabetes, it is after the food is digested, insulin works after food is digested. That is why we categorize it as a Dhatu Agni. So this is the result of a failure of a Dhatu Agni. That is how diabetes develops. So there is dysfunction of the Dhatu Agni and there is destruction of the Dhatu Agni, two stages. And that was, in today's language, we call that as insulin insufficiency or insulin resistance. So this is a busy slide. The only idea is to once again emphasize the Ayurvedic concept of ama as a problem with metabolism and not as an entry of toxins into the body. See, this whole process of metabolism has to be restored for diabetics to become normal. So, this is what we mean as Agni failure and ama production.
To prevent diabetes or to stop?
Yes, what I meant is that what you can see in this slide from an Ayurvedic viewpoint are the failure of Agni at the Dhatu level, Dhatu Agni failure, and the development of ama. Whenever food is digested and gets into the bloodstream, different Dhatu Agnis will come and transform these substances further. Okay, is that clear? Because we are not going to give a modern discourse on diabetes. I'm just trying to bring the Ayurvedic correlation so that in our next presentation I can talk about the treatments, and it will make sense once we get this background. So, gestational diabetes, from an Ayurvedic viewpoint, what we say is that it's when the Dhatu Agni is overloaded, it is overworked, that is the cause for its failure. Like if you give too much work to a person, then he gets fatigued and doesn't work anymore. So this is what happens in pregnancy because of the higher nutritional requirements of the growing baby. There is an increase. And so pregnant women have a chance to develop diabetes because of this overload of the Dhatu Agni. So there are other types of diabetes like what we discussed as LADA and MODI, but they represent a very small fraction of diabetes. So we know from this modern approach also already that you cannot look at diabetes as one condition. This is the point I want to say. In every disease in Ayurveda, we consider multiple parameters. So is this clear? So, but when you talk about diabetes, because of the incidence, the larger incidence is for type 2 diabetes. So when we talk about diabetes, generally we talk about type 2 diabetes. So LADA is autoimmune related. Due to autoimmunity, the pancreatic cells, beta cells are damaged. It's very similar to Pitta type of diabetes described in Ayurveda. So there are some, we'll not go too much into detail, but I just want you to know about it. Very young age, it looks like type 2 diabetes, but non-obese, so it's a bit strange. So just like, Pitta, otherwise Kapha, it progresses from Kapha, but here is directly Pitta. So I will come to that in the next presentation, but please remember LADA when we go back to Ayurveda. So what is the importance is because Ayurveda can help LADA. This group has a high risk for progressing to insulin requirements very quickly. And actually, if you give metformin, can actually aggravate and very quickly lead to progress of the disease. Pitta type of treatment for diabetes is especially helpful in this type of disease. If we do a Kapha type of treatment, then again, it leads to faster progression. So I will come back to that, but I want to show that Ayurveda has some unique things to contribute in this type of diabetes. So then there is the genetic type called the maturity onset diabetes of the young. So it's that in diabetes, even according to Ayurveda, the times it is environmental rather than genetic. So today we can diagnose this by specific mutation in the genes, and so you know a lot about why this type of diabetes manifests. And there are many subtypes. And now we have, this is secondary?
Secondary.
Yes. Secondary diabetes mellitus, which are caused by various other diseases or by inducing by use of certain drugs. So this is the overview of diabetes. Yeah, so I don't need to go into the diagnosis. This is an overview of diabetes and its classification from modern medicine, and we already know that diabetes is not one single condition, but we have to look at multiple parameters. So finally, I'm coming to pre-diabetes again before we start the Ayurvedic discussion. Because, as I was saying, some of the greatest strength of Ayurveda is in the management of pre-diabetes. From a modern point of view, pre-diabetes is still diagnosed only at the time of impaired glucose tolerance. So I want to distinguish here that pre-diabetes in Ayurveda is even earlier than impaired glucose tolerance. So the modern definition of pre-diabetes is impaired glucose tolerance and impaired fasting glucose. So we say that in Ayurveda this is already, too late. The diabetes has already started manifesting. So, because Ayurveda calls this condition as kapha diabetes, not pre-diabetes. So there is a pre-diabetic stage which is called as the prameha purva rupa, the early stage of prameha purva rupa. And here there may not be impaired fasting glucose, neither impaired glucose tolerance. And Ayurveda says that it is that stage in which we can completely prevent the progress of diabetes and have complete control over the disease. So this is the continued, So here is the fact that people with pre-diabetes are already at risk for, is this what is written here?
Yes.
Yes, so that's why we don't call this as pre-diabetes, it's already kaphaja prameha. So now we will go to the next slide, because what is remaining there is only for reference. The next portion is just the diagnosis of diabetes mellitus as per modern, protocols. So at this
presentation, you mean?
Yeah, the presentation is only about. So we'll change the presentation.
Next one. Okay.
This is just for extra reference, so that if you have anybody, because all of the people attending this may not have medical background, so it's for their benefit that I added these other slides. But we will come back to this slide at the end again to look back to what treatments are done in modern management. But before that, I thought now we should discuss Ayurveda, and then we can understand the advantages of Ayurvedic interventions in diabetes. So we will quickly go through an overview of how Ayurveda understands diabetes mellitus. Some challenges in understanding, the challenges in treatment and also research. You can know that today Ayurveda is not used for diabetes management. Unlike musculoskeletal diseases where a lot of people come to Ayurveda for treatment. Because if you are diagnosed with high blood sugar, people usually go to a diabetologist and take medications. So in Ayurveda, the classification is under a category called prameha. Prameha means polyuria, not diabetes. And polyuria is not diabetes. And pramehas are, many types of pramehas are there in Ayurveda, and the king of which is diabetes mellitus. So that prameha itself came to be later equated with diabetes mellitus. So when there is excess urination and when there is turbid urination, then this condition is called as prameha. That's the criteria. So you can see Ayurveda was the first system to describe, I already mentioned this. But it was only in 1700 Common Era that in modern medicine glycosuria was described as a sign of diabetes. So it's only 300 years since the word diabetes mellitus was used. But Madhumeha, which means the same, has a history of 3,000 years. I don't know whether it's something to be proud of or ashamed of. Does it mean that Ayurvedic people were better at diagnosis or had diabetes even in those days? So we look at two questions. What is the understanding of diabetes in Ayurveda? And what windows of opportunity? So I like to ask these questions now. We already gave some hints, some discussions. So what do you think is what is that Ayurveda has to offer in our understanding of diabetes? What aspect of diabetes does Ayurveda give more light upon? What do you think is the uniqueness of the Ayurvedic approach? We discussed some things already. Yes?
That it can offer early diagnostic.
Okay.
And people online are also answering that it is a complex illness.
Complex?
Complex illness.
Oh, illness, okay. Right. Yes, that is already known. But the key thing is that Ayurveda is focused not on the glucose as much as on the ama and the agni disturbances that is underlying diabetes. Mm-hmm. Because of the phenomenal impact of the anti-hyperglycemic therapies and insulin replacement therapies, even modern medicine has tended to ignore this aspect of diabetes. Yeah, because, anti-hyperglycemic treatment, it's almost magical. The effects are magical. And if you give insulin replacement, it's like magic. So we have been thrilled by this magic and forget about ama and agni, which is there behind. So that is the importance, and that is where Ayurveda is going to help, in working on the underlying cause. So now let us go into the classification. So the ancient Ayurvedic texts, one point I want to make first is prameha and diabetes, madhumeha are different. And this is very interesting because Ayurveda says that through the urine many of us can come out, like proteins, bile, blood. So they all that were classified as pramehas. And amongst that, when glucose comes out, then only then we call it as madhumeha. And 20 types of diabetes are described in Ayurvedic texts, and they are broadly classified into kapha, pitta, and vata. And all of them are not diabetes mellitus. So when you come to diabetes mellitus itself, Ayurveda classifies into two types, as I mentioned, genetic origin, and then the other one in which by lifestyle. So in Ayurveda, when we approach treatment, we have to look at it in these two angles. One is the classification into the genetic and the acquired, and the other is the classification based on the doshas into kapha, pitta, and vata. So madhumeha is also a later development. It takes a long time before madhumeha actually happens. So three presentations of diabetes: the kapha dominant stage, which Ayurveda says is easily treatable, and the pitta dominant stage, which is manageable, and the vata dominant stage, which cannot be treated. Okay. So in Ayurveda we say that there are, apart from genetic causes, some of the lifestyle and diet related causes are, sitting for long hours, intake of too much of yogurt, intake of too much of meat of domestic and aquatic animals, milk, and fresh grains, and food made of jaggery. These are said to be very important triggers of diabetes. So asya sukham, which has been repeatedly mentioned in Ayurvedic texts, cause for many illnesses. They say you can sit and die. That's what they. And today this has been re-established through modern studies that if you sit for a longer time, now I am the cause maybe of this problem here. Okay, can you explain?
Yes.
So this study says that mortality by any cause is higher in those who spend a lot of time in chairs. Even if they do exercise, after that it cannot be reversed. So we may think this looks very, very casual. Okay, don't sit, don't stand, like that. But if you go behind the science of it, there's much more than meets the eye. Yeah, what I said is that, some of these simple things that we indulge in our daily lives may have unimagined effects in the long run. And there is in Ayurveda a description of the prodromal stage of diabetes. And there are two elements to this pre-diabetic stage. One is the beginning before kapha prameha, and the other is before vata prameha. So before I explain this, perhaps now it is time to correlate, because that is on that basis we will go to the treatment. So kapha prameha corresponds actually today to glucose intolerance, impaired fasting glucose, and is characterized by insulin resistance. Impaired fasting glucose. When you test glucose in the morning without...
Yeah, but it can sorry.
Impaired fasting glucose. Then impaired glucose tolerance and insulin resistance. In kapha prameha, we will find this is the picture. Insulin resistance is high, there is no insulin deficiency, there is impaired fasting glucose, and there is impaired glucose tolerance. This condition in Ayurveda is called as kapha prameha. And here, by appropriate diet and lifestyle, we can reverse. So it's called as a curable condition in Ayurveda. So what we call as prodromal stage is before kapha prameha. And I emphasize again, this is pre-diabetes. Kapha prameha is pre-diabetes in modern medicine. But pre-diabetes in Ayurveda is before kapha prameha.
Yeah.
So Ayurveda talks about the prodromal stage and also the complications. So these are two areas which is, as I said, Ayurveda is very much emphasizing on. So this is an overview of how Ayurveda understands diabetes. Broad classification, then the pre-diabetic stage, then kapha, pitta, vata, and then the complications. So this is the framework in which Ayurveda diagnoses and treats diabetes. And the interesting thing is all modern classifications can be fit into this framework, because type 1, type 2, then LADA, MODI is coming under genetic, gestational, again related to kapha. Because it's like a pre-diabetic thing in modern medicine, usually it reverses back after delivery. And this is the Ayurvedic understanding of the process of diabetes, and based on this our treatments we will discuss. So the most interesting thing in diabetes is Ayurveda considers mellitus, impairment in fat metabolism as a very important part in development of diabetes. And the ama that is produced as a result of diabetes is called as ama. So the Ayurvedic treatment is very much focused in the early stages on mellitus and in the late stages on kleda. Now this is the key thing of Ayurvedic intervention. So what is the benefit of treating mellitus? We can arrest the progression of diabetes. And when we treat kleda, so these are the two clear, interventions in Ayurveda that makes it unique and different from modern medicine. You can see there's no strong anti-hyperglycemic agent in the Ayurvedic picture of things. So what Ayurveda says is that you have to first prevent mellitus and kapha from getting deranged. When they get deranged, they produce kleda, and the kleda leads to all the complications of diabetes. Is this clear? So now we can summarize. So the Manohar concordance, if you compare with modern medicine, you can say type 1, type 2, insulin resistance, insulin deficiency, and insulin dependency. So there's a clear correlation between the modern and Ayurvedic classification. Now Ayurveda says that prameha can develop as a sequence, or people can develop it directly. Like for example, so you can directly start with vata prameha, or you can directly start with pitta prameha, or you can progress from pre-diabetic to. So this is depending on our genetic predisposition, depending on our diet and lifestyle, it can happen in any way. So it's almost like allopathic and Ayurvedic treatment are perfectly complementing each other. Because in Ayurveda the focus is on kapha, mellitus and kleda. In modern medicine it's on glucose, which is the outcome of kapha, mellitus and kleda. So the limitation of Ayurveda is that it cannot bring down glucose levels drastically. It can do that only over a long period of time. So like yesterday we saw what modern medicine could do in 6 months with methotrexate, Ayurveda could do only in 9 months. But the advantage was that Ayurveda had less side effects and worked in more number of people. So Ayurveda differentiates between sweetness in the body, which is the blood sugar, and sweetness in the urine, which is urine sugar. And now which dhatu has to be focused in prameha? And we say it is rasa dhatu. So now we are coming into the treatment. So we have to target the rasa dhatu. According to Ayurveda, it is the overloading of rasa dhatu which is actually the cause for the destruction of the dhatu agni of rasa dhatu and thereby the development of prameha. Yeah, the agni of rasa dhatu is damaged. See, when we eat food, it all gets converted to rasa dhatu, right? Rasa dhatu has to be further transformed to develop other dhatus in the body. Your food becomes rasa dhatu. Rasa dhatu becomes the remaining dhatu. So food is digested by agni in your stomach, jaఠaragni. Rasa dhatu is digested by rasa dhatu agni. So when we eat, the causes that we discussed earlier, asya sukham. When we eat a lot, when we sit a lot, what happens is rasa dhatu circulation is affected. It stagnates. There is less glucose uptake, and we need to be active for rasa dhatu to be transformed. So when we looked at the causes, I will tell you, these are causes. These are the causes?
No, these are complications.
So what are these causes? All of them will increase rasa dhatu to a critical level that will put a stress on the agni of rasa dhatu. That is why they are considered as causes. So it's not a simple, listing of causes. Increase rasa dhatu. Today we call this as glycemic index. If there is a sudden rise of blood glucose, we call it as high glycemic index. So if we create a condition in rasa dhatu, where rasa dhatu is peaking very quickly, very high, then it is a predisposition for diabetes. So we have to prevent diabetes and to clear diabetes, the purity of rasa dhatu is the most important aspect in Ayurveda. So rasa dhatu is like the energy currency. If you look at the functions of rasa dhatu, a lot of similarity with glucose actually. So rasa is also known as ojas. Rasa itself is known as ojas because rasa supplies the energy currency of the body. And so if there is no rasa reaching the tissues, then it means the tissues cannot function. So it's like, that's why the functions of rasa and glucose are very similar if you look at this description. So what are the anti-hyperglycemic agents in Ayurveda? Diabetes, anti-hyperglycemic are those which can help the transformation of rasa dhatu. Those are the ones which will work as anti-hyperglycemic. Because hyperglycemia means excess rasa dhatu. And many of the herbs which are used in Ayurveda for controlling blood sugar levels have the property of burning rasa dhatu. So now we are building the treatment protocol for diabetes in Ayurveda. So first of all, we are going to look at prevention. The modern medicine has only been partly successful because, like we say, smallpox has been eradicated. Smallpox?
Smallpox?
You don't know?
Smallpox.
It's no longer there, but it was a very severe disease previously, smallpox. Now it's not there. But diabetes is increasing. Oh, I'm sorry, the terms are different in Russia. Now, what I want to say is that diabetes, we have not been successful like other diseases because we could remove smallpox, but diabetes is increasing and the burden from diabetes is on the rise. So how can we say that we are successful? Therefore, it's very important to look at these aspects of Ayurveda because these are the ones which will help us to prevent the epidemic of diabetes from spreading. So for the prevention in the early stage, what Ayurveda calls as pre-diabetic, what will we target? Which dosha? Which dhatu? In the beginning will be focused on kapha, yes, and then rasa. A more important thing I discussed in the beginning, medas. So kapha and medas are the two dhatus which we have to focus on in the beginning stages of diabetes. And especially medas is very much important in the early development of diabetes. And here two things, one is of course the lifestyle and the other is the Ayurveda gives us a classification of food, you know, which we can correlate to modern understanding also. And Ayurveda seems to be one of the earliest systems which talked about glycemic index and classified food based on glycemic index. So we have lakhu santarpana, which is digested very quickly and suddenly creates a load on rasadhatu. These are the foods which today we call as having high glycemic index. And then we have guru santarpana, which creates a gradual increase in the glycemic load. And then we have lakhu apatarpana, and guru apatarpana are foods which have low glycemic index. See, dietary interventions are gaining more and more importance in the management of diabetes, and this is one area where Ayurveda has tremendous scope of interventions to offer. So, if you were to have one group of subjects on modern dietary management and another group on Ayurvedic dietary management, you can see the difference. So Dr. James is sitting here very silently, but he is now involved in a couple of studies which is going to look at what is the difference between an Ayurvedic diet and a modern standard diet in the management of diabetes. He's sitting very innocently, but he's he's going to do something. Because we found that many foods which are, according to Ayurveda, not recommendable for diabetes, modern doctors are allowing, because modern concept is based on calories. It's not based on rasadhatu, kapha, medas and agni. So there is no idea about the harmful effects of some of the dietary elements. And this is where Ayurveda, if you use this scheme, you know, it should not increase rasa. How can we control kapha and medas? Through rasadhatu. If rasadhatu is clear, then kapha and medas, food substances which are recommended by modern doctors. In fact, modern doctors, by modern doctors are to Ayurveda. Because in modern medicine, they look at only calorie restriction. There is no question of rasadhatu, medas, kapha, agni, these kinds of rasa, kapha, medas. So, as I was saying, that we can give a more customized, a more effective diet that can do a lot of wonders in reversing prediabetes. We were discussing just a few days ago, and I'm again reminded of James, Dr. James. So we were discussing that in modern medicine, in the pre-diabetic stage, they advise diet and also metformin sometimes, and only 1/3 are able to reverse. The rest eventually progress to diabetes. But if you change the diet as per Ayurveda, then there could be a lot more survivors. You know, we can greatly enhance the rate of reversal. So we can go to an allopathic doctor and ask what are the foods that I can eat, then bring it to an Ayurvedic physician, he will cut. The interesting thing in Ayurveda is that we can modulate the properties of the dietary articles by processing. So we have nutraceuticals for diabetes, which is a very, very rich area of exploration, which is, you know, food that is processed, semi-processed with some medicines. For example, wheat. In Ayurveda, we say wheat should not be given as such to diabetics. In wheat, we have to treat it with triphala. So, wheat fortified with triphala, or triphala wheat, you can create that wheat, and now it becomes very good for diabetic patients. So later I will show some herbs, and many of these herbs can also be used to treat, grains and food articles before introducing into the diet. And this is also being explored, that probably this treatment of wheat could have an impact on gluten in the wheat, because that also causes a lot of problems. So in this way, what Ayurveda offers much more than medicines in diabetes is the modified dietary, preparations. Yes, so that, gluten is one of the challenges of use of wheat, and the treatment with the herbs is probably targeting that so that it doesn't produce an allergic reaction in the body. So this is very interesting that Ayurveda has talked about how to treat wheat before you eat it. And this is a classification which we use. So can you tell which is the ideal category for diabetes? Which is the best choice? Because the body is actually deprived of glucose in prameha. So this will lead to permanent deprival of glucose in the body. Is that good or bad? Is it good? Because the body actually needs glucose. So this is not advisable.
And that was Lakho Apatakan.
Yes. Because what we want to avoid is a glucose overload, not a complete denial to the body. And you must also remember, yes, so we know that people who are on diabetic medications, they are more at danger of hypoglycemia rather than hyperglycemia. And people have to carry sugar in their hands to take it when they have this hypoglycemia. If they are on medications, then there's a greater chance of it going down. So Lakho Apatarpana is not advisable. So which is the best?
Ram, sorry, I have to translate for the online listeners.
Okay.
But I need you to repeat.
Repeat it, okay. So what I said is that in diabetes, especially those on medications, there is more danger of hypoglycemia. So Lakho Apatarpana is not a choice. It leads to glucose deprival. Yes? Yes, exactly. So it's Guru Santarpana which is actually needed in the long run. True. Is this Guru here means slowly digested. This is very quickly digested and absorbed. So we make the foods in such a way that they are Guru and Santarpana, and at the same time will not increase Rasa, Kapha or Medas. So this is the principle of diet. So, but in actual practice, we will have to make a combination. Because especially in the early stages of diabetes, Guru Santarpana is very dangerous. Because that is a stage of insulin resistance.
There are some questions.
Yes, we can take it.
Yeah, can you answer? So, first question, can we ask what would Veda pulse show in pre-diabetic stage?
Oh, we have to study that. Yes.
Our doctors tell patients to wait until diabetes becomes full-blown, so we do not have a method to prevent in the UK.
Oh, that's a very dangerous approach.
I guess it's not a question. No, yeah. Do you have any comments on this, or?
On just their approach? Yeah. Yes, I mean, as I was mentioning, the modern approach is almost entirely on blood glucose levels as a criteria for diagnosis as well as improvement of diabetes. And this is a very limited approach. And I already mentioned, so it already makes diabetes diagnosed at a later stage. So I would say that that is where Ayurveda can give a new perspective, and we need to develop some diagnostic methodologies to implement and bring into practice the Ayurvedic idea of pre-diabetes, which is earlier to what is called as pre-diabetes in modern medicine. And I believe that for the better management of diabetes in the future, our attention must shift from just oral hypoglycemic agents to other aspects of diabetes. So even the animal models that we use for studying the effects of medicines in diabetes are very limited.
Animal
Models are very limited. You're only looking at one mechanism bringing the blood sugar down, not the total pathology of diabetes. You use some toxin and damage the pancreatic cells and then see if the medicine is working. But this is not the way Ayurvedic medicines work. The attention has to change from glucose to rasa, kapha, medas and agni. That is the shift in Ayurveda. This is also the point I want to make, is that you cannot look to Ayurveda for another herb, which is an alternative to a modern hypoglycemic agent. That's not the way Ayurveda comes in to the picture. What I meant is that you cannot ask which is the herb which we can use to, give to a diabetic patient, or where is one supplement which you can give and blood sugar will come down. I mean, that's not the approach of Ayurveda.
Потому что это, опять же, аюрведа такой подход не использует.
So we have a whole approach, and that should actually be incorporated into the pre-diabetic stage instead of not treating that patient at all.
Any clinical studies done on marmotherapy for diabetes?
No. See, it is also an expectation to cure the disease magically. A disease caused by lifestyle and dietary faults cannot be corrected by pressing 1 or 2 marmas in a day. What can marma do in diabetes? It can help in a limited way with some of the complications of diabetes, like the diabetic neuropathy. So some relief of symptoms can be obtained.
Чтобы получить, ослабление некоторых симптомов.
But we cannot correct by some external simple manipulation what we created by years of bad lifestyle and diet. So diabetes is a disease where the clear message is shortcuts don't work in the long run. So now we come back to this discussion because we left at a very important point, and there was an interesting observation that Guru Santarpana will increase kapha and medas, so there's a big question mark. So how do we solve this problem? What can be done to ensure that this type of food doesn't produce kapha, medas? So that's the key thing here, that in diabetes we have to maintain agni and then use this food, because otherwise the same food can be counterproductive. So when there is no agni, you have to use lakhu apatarpana, especially early stages of diabetes. But the long-term goal is to stabilize agni and give Guru Santarpana. So do you know of any Guru Santarpana foods that are available here? Grains, wheat. So wheat was considered as one recommended food in Ayurveda because it is Guru and Santarpana. It has got a moderate glycemic index, not very high, whereas rice has a very high glycemic index. Rice is Lakhu Santarpana, and wheat, barley is also Guru Santarpana. You use here? Yes. So that is also good. That is also good. In fact, in Ayurveda, barley is called as yava. Yava, and yava is recommended in diabetes. It reduces kapha. Main thing is it reduces kleda. So as I told, in diabetes, the Ayurvedic targets are rasa, kapha, medas and kleda. And not just bringing the blood sugar down. So when we achieve this, in fact, in my clinical experience, the focus is on kleda. Kleda is very important. That's why yava is so important in diabetes, because it can remove the kleda. So the target is rasa, kapha, medas and kleda. That's the first. So I have found also in our clinical experience that a lot of people, even when they are on anti-hyperglycemic agents, they experience a lot of fluctuations. Immediately the blood sugar comes down, but after that they find it very difficult. And when we start our treatment, they stabilize much faster. See, most of the herbal medicines do not have very strong anti-hyperglycemic activity. And now I'm going to tell that there's some advantage of adding Ayurveda to allopathic treatment in diabetes and how we should do that. Suppose a patient is already on some anti-hyperglycemic medication and now they're not so stable or needing higher doses. So that's the time they come to an Ayurvedic doctor. The doctor is trying different agents or increasing the doses, so the patient is concerned. They come to us saying, now can you do some Ayurveda? So many Ayurvedic doctors, thinking in the modern way, try to look at herbs which are also anti-hyperglycemic and add it to the allopathic medication. But that is of no use. By adding another herbal anti-hyperglycemic agent, you may induce sudden hypoglycemia. Both will. So, what is more effective is to look at the Ayurvedic targets like kapha, medas, kleda and rasa. If you give such medicines, what we have found from experience is the modern anti-hyperglycemic drug works better. And we need less dosage and they stabilize. And one herb which we discussed yesterday, which was also used in rheumatoid arthritis, is guduchi, Tinospora coleus. There's actually another variety of Tinospora which is called as Tinospora crispa. Tinospora corifolia is the most widely used, but there's another variant called crispa, which is even better for diabetes than corifolia. So this is working on the other pathologies in diabetes, not directly on the sugar. So it helps. And guduchi is a very good adaptogen. I discussed yesterday, it's used also for chemotherapy. Along with chemotherapy, it's a rasayana. It has the ability to also prevent future complications in diabetes. So I'm going into the treatment, but I want to come back again and tell that diabetes is really a lifestyle disease, and lifestyle interventions are really the most powerful ways of controlling the disease. There was a study in Australian Aborigines. When they came out of their natural habitat, they suddenly developed diabetes. And when they were asked to go back to their original habitat and live their normal life, they all got cured of diabetes. So this is the fact. But we are not willing to change our lifestyle and diet. So we have to talk about medicines also. So we have to talk about medicine. I can tell you very clearly that if we diagnose early, give the customized Ayurvedic diet and bring about lifestyle changes, then we can reverse. So because we don't do that, we have to do this treatment also. So in diabetes, if we have to then go for full-fledged treatment, then we recommend Shodhana also in diabetes. So what will be helpful? Vamana, yes, because in the early stages, for removal of kapha, Vamana may be helpful. But in actual practice, it's more easier to do Pachana and Shodhana on a regular basis, which is purgation, Virechana. These are helpful in the early stages of the disease, not in the late stages. Because the whole picture changes. There is weakness of the dhatus as diabetes progresses. And then it becomes more and more difficult for us to do Shodhana treatment. So this can be done only in the beginning. So when we Shodhana aim to remove the excess kapha and kleda from the rasa dhatu, and so Shodhana can have dramatic results in the early stages of prameha, of Madhumaya. So it can correct metabolism. Metabolism changes. So I was mentioning yesterday of a recent study published in Nature by a group of researchers in the US. It's a very rare of study like this gets published in a high journal, which they looked at some treatments in Panchakarma. So as a result of that procedures, the metabolomics of the body is completely changing. So same thing happens in diabetes when you do it. The whole metabolism completely changes. First time it could be demonstrated, through measurable chemistry, chemical markers. So after Samshodhana, we have to do Shamana, which is balancing and regulating, and then Brahmana, and then finally Rasayana. So in Kapha type of Prameha, Samshodhana is indicated. Pitta type Samshamana, and Vata type Brahmana. And actually giving glucose is the kind of Brahmana. Because in Kapha type we are trying to reduce insulin resistance, so that is achieved by Samshodhana. In Pitta type we are trying to facilitate insulin secretion, Samshamana. In Vata type we are replacing insulin, giving insulin inside, it's Brahmana. Because only when you give insulin, tissues are able to get glucose, so it's a Brahmana treatment.
When we give glucose?
When we give insulin.
Insulin.
Glucose is utilized, and Rasayana is advisable in any stage of the disease. Okay, this is the principles of treatment. Okay, so the real cause for diabetes according to Ayurveda is what is called as Rasa Shesha Ajirna. It means that residual accumulation of Rasa Dhatu. And that residual accumulation happens because the Agni in Rasa Dhatu is not transforming it further. So now if you come to the treatment, sorry?
Yes.
Yeah, so I said the focus is on Rasa Dhatu and Medo Dhatu, and specifically we have to treat Rasa Shesha Ajirna. Yeah, you know, Medos and Rasa Shesha Ajirna are the target, and the diet and exercise have a direct effect on Medas and Rasa Shesha. So today, very little of Ayurvedic treatment is actually done in practice for diabetes. And now I want to build the treatment algorithm. So this is just once again I'm showing the classification. I hope you remember it. And next slide is the diagnostic criteria as per Ayurveda. So the Ayurvedic treatment protocols can be classified into these categories. So the treatment protocol for the prodromal stage. Yes, so what I have, 1, 2, 3, 4, 5. There are 6 protocols that we can derive for management of diabetes. The first protocol is for the prodromal stage. It's mainly diet, exercise, lifestyle, and nutritional supplement. The second stage is Kapha stage of diabetes, is diet, exercise, and medication. In the Pitta stage, and here also Shodhana, some Shodhana. And in the Pitta stage, you have some Shamana treatment with diet and exercise. And in Vata stage, you have Brahmana treatment with diet and exercise. And in the complications, you have treatments to prevent these complications. That's another treatment protocol. So we have protocol for macrovascular complications and treatment protocol for microvascular complications. And then we need some guidelines for interactions between Ayurveda and allopathic medicines. Okay, so this is the principle.
That's the principle.
So can we just recollect this? Stage 1, prodromal stage. What is the treatment? Lifestyle, and one more. Yes, specialized nutritional supplements. They are not full-fledged medicines, are not needed at this time, but modified food substances. In the second stage, Kapha. Second stage, Kapha, diet, lifestyle, Shodhana, and also some medication. You start introducing medications from this stage. Many Ayurvedic doctors confuse Kapha Prameha with prediabetes, and they don't give medicines. This is dangerous because it is already Kapha Prameha. So we have to give Kapha medicines in Kapha Prameha. In Pitta type of Prameha, what is the line of treatment? Diet, lifestyle, of course. Then some Shamana treatment. And for Vata type, Brahmana. Diet, lifestyle, and Brahmana. And for macro and microvascular complications, we have treatments which are basically focused on Pachana, Agni, balancing, and mild, slow removal of unwanted ama from the system. So this is the overall approach to management of diabetes in Ayurveda. So what are the benefits of Ayurvedic treatments in diabetes? Long-term blood sugar control. Long-term, not immediate. So if you have two groups, one group receiving only allopathic medicine the other group receiving Ayurveda and allopathic medicine. The second group will be stable in the long run. When I started my clinical practice, I thought insulin dependent we should not use because it's Vata Prameha, no insulin, we cannot treat. That was my initial impression. But I was surprised that when I actually started treating patients who were taking insulin, it was possible to greatly reduce their insulin requirement. It was a surprise. We may not be able to stop insulin, but we can reduce. And other anti-hypoglycemic agents we can stop. If we do good Ayurvedic treatment, we can take them off, these medications. One another condition in which Ayurvedic doctors have been very successful is in management of diabetic gangrene, diabetic foot, lot of amputations. There are records of having prevented amputations in diabetes. Then there are the micro and macrovascular complications, in which also Ayurveda has been found to be helpful. Is this treatment protocols clear? It's a little bit more straightforward than musculoskeletal diseases. Here we have 6 specific protocols that we can, customize and follow. You can see very little research has happened on diabetes. Papers are published in very not so good journals. So if you look at good journals like PubMed, we have only 290 and only 98 human trials. Amongst the drugs which have been studied most, there is one drug only which is from the classical texts given importance, that is Tirocarpus marsupium. It's called asana. I will show you the picture. Asana, A-S-A-N-A. And then we have other herbs like Gymnema sylvester or Coccinea indica, and Momodica charantia is the bitter gourd. People have talking so much about its use, but it is not so effective. This herb Gymnema sylvester, if you chew in your mouth, you will not be able to get taste after.
Sweet taste?
Yeah, you will lose the ability to perceive sweet taste. Gurmar, yes, exactly. It kills the sweet taste. But this is not a real medicine for diabetes. It only makes you not eat food because your mouth is losing the taste. And Coccinea indica is a vegetable actually. If it was really effective, a lot of people in India would have had very low blood sugar levels. A lot of people in India eat this every day as a vegetable, and still they have high blood sugar levels. So most of the time wrong herbs have been chosen for study, and they have always looked at blood sugar level. The biggest problem is most of the studies are on animals, and as I said, they are artificial models which don't really help us to understand the effect of Ayurvedic medicine. Artificially induced diabetes. They are not real diabetes. So I want to show some studies which gave very interesting findings on what Ayurveda can do in diabetes. So here you can see they tried to bring many things together: exercise, diet, meditation, herb, and they looked at HbA1c and what was the effect of this Ayurvedic intervention on, because long-term control, not. So this showed that these Ayurvedic treatments had more impact on people with higher HbA1c values. They were able to have more significant decrease. Glycated hemoglobin. Yes, the hemoglobin combined with glucose. So now what's interesting here is that this shows that Ayurvedic medicines may not be working by bringing down blood sugar levels directly, because it worked only on people with higher HbA1c values and worked over a long period of time. It means Ayurvedic interventions working on the total pathology of diabetes, not just bringing down the blood sugar. So it's important. The higher the HbA1c value, the better the change was with Ayurvedic. So here is in a systematic review is available on all Ayurvedic treatments on diabetes. But now it's time we have a new systematic review. So maybe we have a collaboration and do a new review which is updated. It's time to do that. So this is interesting. You know why the systematic review was done? is because in the US at that time, people were telling that Ayurveda should not be considered because there's nothing in it and no studies are available. So to show that it's not like that, this AHRQ, they created an evidence report summary. So this was in 2001. And with that, they could create interest in the country that no, Ayurveda has some evidence. So these are the recommendations. They came up with a lot of recommendations on diabetes. Later, they found that they came up with also specific herbs. I don't know, many of them are available here. Is Coccinia indica available here? No. Holy basil is available. Fenugreek? Yeah, these are patent formulations. So now there's a Cochrane review also on Ayurvedic treatment for diabetes mellitus. But the Cochrane review says that the evidence is not strong enough for recommending treatment. So now we will look at the plants. So here's one of the plants which is a major ingredient in anti-diabetic formulations. And you know what makes the Ayurvedic approach different is that we will not plan anti-hyperglycemic agent. That's not the way Ayurvedic logic looks at. We have to target in every prameha, we are focusing on rasa, we are focusing on medas, kapha and kleda. That is common for all pramehas, all diabetes. But specifically, depending on the dosha, we will choose specific herbs. For kapha prameha, we use different formulation. For pitta prameha, we use different formulation. For vata prameha, we use this. This is very success. Yes, so you will not get a result by giving, like for example, if you say curcuma used in diabetes, according to Ayurveda, if you give it in all types of diabetes, it will not produce result. So now the curcuma is used to test in diabetes, and it's mentioned in Ayurveda also. Now can you tell me which type of prameha curcuma will be helpful? So it's not good in vata prameha, it's not good in pitta prameha. So this is the additional knowledge that is very crucial. The problem that happens, so if you were to do a clinical study, curcuma versus some allopathic medicine, and you mix all types of patients in that group, kapha, pitta, vata, you will find that many people it's not working well. And then you will say it's not effective. Or you may get a wrong idea, not as effective as it would be only on the kapha people. I have seen people, because in Ayurveda it is mentioned in amalaki juice, gooseberry juice, you mix curcuma and drink in diabetes. And I have seen people going into hyperglycemic crisis by not taking any allopathic medicine and drinking this continuously. No effect. So it will work in kapha prameha, but not in so much in the other prameha. So here is another herb. What we need to understand where to give it. Do you know about this herb? It's called as khadira in Sanskrit. Acacia is a commercially important plant because the acacia gum comes out of it.
We have different types of acacia.
Okay. So this is working on kapha again, and it also works on pitta. So it is used in combination in both kapha prameha and in pitta prameha. It's said to be a good purifying agent for the blood purification. And especially it's very good for kleda in prameha, kleda. It removes kleda. And it's good in skin diseases also. And also in diseases of medas it is helpful. So that is why it is used in prameha. But it's never used alone, it's used in combination. I made a mistake in the heading, it's the curcuma. It happened when you make slide in the midnight. Okay, so then I said, we discussed already about curcuma, and it's very strong for kapha. It removes kapha prameha. No, it increases pitta a little. It's very strong. It can decrease kapha pitta, but kapha pitta is different from pure pitta. It is not so good. In pure pitta, it is not so good. So kapha pitta is okay. If pitta is along with kapha, then it is not a problem. But in pure pitta conditions, it's not so helpful. Especially alone. You can use in combination. It's not bad. In combination, it's okay. This is the key thing in Ayurveda. That is why we use drugs in combination. Why I mentioned was, in the West, usually we use single herbs more. And that's why more side effects are coming. So in Ayurveda, we never use herbs singly. We use in combination. It's a good question because, this is why we need to understand the importance of dosha in Ayurveda. Because curcuma is also anti-inflammatory. So we may have a question, inflammation is pitta, and then how does curcuma become, So that is where we need to, that is where the doshic classification is important. There are inflammation which are more pitta dominant, which are kapha pitta dominant. So that differentiation is very important. Like for example, licorice is also anti-inflammatory, but is more for pitta, pure pitta. Licorice is more pitta anti-inflammatory, whereas curcuma is not for pure pitta, it's with pitta with also kapha. Now this is, if you ask me, which is the most acclaimed herb in India and especially in Kerala for diabetes, then this is the one. It's called as Salacia reticulata, and it's also called in Sanskrit as Ekanayaka, means the only hero for diabetes. Eka means single, Nayaka means hero, the leader. So in many formulations which we use in Kerala for diabetes, this herb is ingredient. So this is used in combination in both kapha and pitta types of diabetes. And it is said to also, promote secretion of insulin from the beta cells of the pancreas. Then we have this other herb which is called asana, Chirocarpus marsupium, and this is a herb from which even at the Indian governmental research agencies have developed a formula. Another herb called the Indian plum, Syzygium jambolana. There is a black plum-like fruit. So this plus this, that combination.
Jambolana.
Jambolana. Do you know this herb here? This tree? No. So it's very much like a plum fruit. It's specifically recommended for diabetes. This is a fruit which is in Ayurveda allowed for eating by diabetic patients. And this Chirocarpus plus this combination has been found to be very good management of diabetes. And Chirocarpus marsupium is also effective in kapha type of diabetes. And it is reducing mellitus also from the system and kleda. So it is one of the few herbs, trees or plants which can target all the four things in prameha, that is rasa, kapha, mellitus and kleda at the same time. The kleda causes all the complications in diabetes. And therefore any herb which works on removing kleda will prevent complications in diabetes. This is, it is actually a drinking cup made of the wood of this plant and given to diabetic patients. So you boil the water in using this wood, pour it into the wood, stir in this wood of the plant, and then drink it regularly. Then the kleda in the system is controlled and you can prevent all your complications of diabetes. Now this is helpful in pitta type of diabetes. So could you make out all the plants that we have discussed so far are targeting on which doshas? Kapha and pitta. So far we did not find a plant which works on vata. That's why Ayurveda say vata diabetes is incurable. No herb for vata diabetes. Insulin. Insulin is the only way. Now we have Ctenospora cordifolia. Can you tell which, now I would like you to tell which is the dosha. This dosha is fine, but which are the doshas in which it is more likely to work. Even when a drug is tridoshahara, there are certain doshas in which it is predominantly active. I'm amazed that you have a lot of understanding about Ayurveda and Ayurvedic herbs. You have studied before? Oh, okay. So it's a great teacher.
We can ask our online listeners if they know which dosha.
So you know it is a very good anti-inflammatory agent in which pitta is dominating. So it is pitta kapha. So we can know this because there is a combination of guduchi and herbs mentioned in Vedic texts and the pitta slash majvara. It is clearly mentioned that it works on pitta kapha situation where pitta and kapha are dominating. But the advantage of Tinospora is that you can use it also, because it is Tridoshahara, you can use it also in advanced stages of diabetes. Some of the other herbs you cannot use after a certain stage. The diabetes is advanced, you cannot use, because they all increase vata. While it is not going to correct the vata problem, it will not work against vata. So that is the importance of knowing it is Tridosha. So we have one churna which is used, a powder, herbal powder, which made mainly of guduchi adi churnam, and this is used in all stages of diabetes. So I hope you're able to get an idea about how the protocols are developed in Ayurveda based on the 6 categories that I mentioned, and how we have to choose the right herbs. I mean, that is the key thing in success. Based on the doshas, we have to choose the right herbs in the right type of diabetes. So Oleg was asking me, can I explain some Western herbs for diabetes? And I said not now, because I do not know the doshic. I know some Western herbs which are used for diabetes, but I cannot give an Ayurvedic explanation because I don't know what doshas they are. I need to study them a little bit more, because otherwise it doesn't make sense, because you will also ask me which dosha can you give that herb. And when you come to vata diabetes, we do certain things which are not acceptable by modern medicine, like we give ghee, medicated ghee in vata diabetes. And a modern doctor would say, oh, this was dyslipidemia and this because all kind of problem, how you give this? But I was also initially, but I've seen some of my seniors, and I have also given now. Many patients have given this. This gridam is called Dhanvantaram gridam. Dhanvantaram gridam. Gridam. Thailam is different. Thailam is totally different. Gridam is ghee.
Ghee.
And this is very effective in the peripheral neuropathy. But the only precaution you have to take is you have to see that there is no ama in the system and agong, and then you can give in vata diabetes. There is no doubt. I have experience. And there are also some iron-based formulations used in diabetes. Iron. One of which is called ayaskriti. It's made out of iron. Iron and herbs together. And these are, and it's made into a fermented preparation. Arishta. Arishta, it's medicated wine. And I have good results from in controlling with these medicines, these 2 medicines, Dhanvantaram Gridam and Ayaskriti. And then we have, I'm sure you know this, fenugreek. So fenugreek is also said to be good in diabetes, but it is a diet, it is not a medicine. I have seen many people taking this in the morning on empty stomach with the hope that they will get cure from diabetes. But it doesn't work that way. In my understanding and experience, it should be taken along with food, because it works just like akarabose. It prevents the absorption of food, so that if you take fenugreek along with your diet, the absorption of sugar will be slow. So you can mix it with the food that you eat, so that it will be slowly digested and slowly absorbed. So it cannot, if you take on empty stomach, this does not have an effect. Absorption of glucose will become. So in Kerala we had this tradition of mixing it into the food preparations that we use. So you can see that the herbs are, there are many more herbs, but if I discuss big formulations all of a sudden, it might be confusing. So I'm not going into those details. But you can know that there are many herbs and we need to know the dosha impact, which ones work on kapha, pitta, vata, which ones work on rasa, medas, kleda, and which one work on all, which one will disturb other doshas. If we know this about the herbs, then we can use it in the correct type of diabetes. Now the question for vata prameha, for insulin, is there any alternative? Insulin. For insulin, there's only insulin. But I want to show some new possibilities. This is a tree called as mahogany. You heard? Mahogany. It's used as timber for wood. Many people in Malaysia, this is very famous. Malaysia, this is very famous.
Очень известно.
There's somebody from Malaysia.
There's one listener from
One listener from Malaysia. Okay. So maybe he knows more about this herb. People have claimed miraculous effects by using this. This is the seed which is used. It's extremely bitter. If you just touch it, or if again you bring your finger to the mouth, then you can feel the bitterness for a long time. It's very interesting that a lot of studies were done on how this might be working, and they discovered a molecule from this herb. It's called sweetenin, which is an insulin mimetic agent, insulin mimicking agent. Means it is not insulin, but it goes and works just like, so it's called as an insulin mimetic agent. So now there is a new discovery and research on insulin mimetic agents, and this may be an alternative for insulin in the future. We need to do more research, and especially Ayurvedic formulations indicated for vata type of diabetes may have these insulin mimetic agents in them. So this needs to be studied, and in that they could clearly demonstrate in animal models and in vitro studies that this molecule is behaving just like insulin. So you can see one such product of herbs is called as episulin. It's an insulin mimetic agent. This is able to reduce the requirement for insulin. And when people are on insulin, they get this hyperspleen, fluctuations that people struggle with insulin therapy. But this is developed in the Manohar University. So I was just there last week, and that's how I came to know about it. It's done, developed by allopathic doctors. And so I want to say that when you bring Ayurveda and modern science together, very possibilities are opening up. Because, the concept was not so well explained in Ayurveda. It's hidden in the concept of, vata prameha. And now, when we did modern studies, they could accidentally discover perhaps these are working in this pathway. They work as insulin mimetics. Can we go back to the first presentation? That's why I'm concluding. So, can you see the correlation? So this is from modern medicine. A, diet and exercise. B, oral hypoglycemic therapy. C, insulin therapy. Can you see the doshas here? Which is which dosha? A is kapha, B is pitta, and C is what? I was struck by the correlation. Was in Ayurveda, which we expanded into 6, is much more comprehensive and includes additional components that can make it. This is copied from a modern presentation on diabetes. And the last slide, can you go to the diabetes 02? And then we end. Formulations. I didn't want to go into formulations because, yes. So these are the various formulations that we use in Ayurveda from kapha to vata. So they are big formulations, many ingredients. Why? Because the diabetes present from kapha to vata, it's a spectrum. You have pure kapha, then kapha pitta, then pitta kapha, then pitta, then pitta vata, then vata pitta, and then vata. So diabetes progresses that way. So at each stage, by using combination of herbs, you can target it more specifically, and then the outcomes are much more better than just giving a single herb or just doing, one or two interventions. So, Dr. Oleg, did you want me to say one or two words about Indra? And then I can conclude here because I forgot yesterday. So, as you can see, there is a lot of potential for Ayurveda in various diseases, but there is a need, you can see, to bring modern researchers and practitioners and Ayurveda people together. We can do this only together. A lot of potential things are not being put into practice because we are not working together to bring it into actual application. So if we bring researchers from around the world together from modern and Ayurvedic fields, and we can identify areas and focus on specific diseases, in a short time we could develop validated treatment protocols that can be globally used, and that would really make Ayurveda leap forward into the future.
I lost part of the sentence.
Okay, all I said was we need to bring both modern scientists, Ayurveda professionals, modern practitioners together to develop Ayurvedic approaches into established protocols so that everywhere it can be used with proper guidelines. So we have in Europe, we have established a network of researchers, and this network is called Indra. And Ayurveda was discovered first, brought to humanity from Indra. That is the story. So we choose the cold regions of Europe because Indra likes cold region. Indra lives in a cold region. I will ask Indra whether he prefers Siberia because it's colder than Europe. But anyway, Indra would like to visit Siberia. It's an international network for development of research in Ayurveda. We have brought together very established universities for modern medicine as well as Ayurveda and modern science together to form a core group. We have about 20-30 members now. So you have to be a modern or an Ayurveda practitioner to join this. So Dr. Oleg is also now part of the network. We were a closed group, but now we've decided to open out and network with the whole world. So Indra is going to be registered in Italy very shortly. So this is an announcement and an invitation to participate and to work for this cause so that we can bring Ayurveda from Indra means 1,000 eyes in the skies. And we bring Indra, the knowledge of Ayurveda through Indra to the entire globe.
Ram, there are some questions.
Oh, okay.
How exactly do you use Triphala to prepare wheat in?
Okay, that's a good question. So we have to put the wheat in the decoction of Triphala. In the night you put it in the Triphala decoction, soak. In the morning you take it and dry it. Morning is for drying, night is for soaking. And then after one full cycle, 24-hour cycle, 12 hours for soaking, 12 hours for drying, you can use it as food.
Is it grains or flour?
No, the grain.
Grain, I don't know. Where can we find descriptions of what Lakhu and Guru mean?
They are there in the classical texts. So Lakhu and Guru have two meanings. Maybe I give one further explanation for that.
Okay.
Is that definition of gunas in the even classical textbooks, what each guna mean, and Lakhu is that which reduces the weight of the body. That is one definition. So which means that which stimulates catabolism in the body is Lakhu. And Guru is that which increase the weight of the body. So that which promote anabolism is Guru. But Guru Lakhu also mean Guru which is slowly digested is also Guru. Any food that is slowly digested is also Guru. And that which is quickly digested is Lakhu. So in Pramay we say Guru Lakhu, it means with digestion, not with the weight of the body. Not metabolism, digestion. So Guru Lakhu means both digestion and metabolism. So if in Guru at the level of metabolism increase weight, Guru metabolism Lakhu decrease weight. Guru at the level of digestion means slowly digested. Lakhu at the level of digestion means quickly digested. One more time. So Guru and Lakhu explain on basis of metabolism and digestion. Guru on metabolism increase weight. Lakhu on metabolism decrease weight. Guru on digestion slow digestion. Lakhu on digestion quick digestion. The fact is that which is Guru by digestion need not always be Guru by metabolism. So we have 4 combinations. Guru on digestion but Lakhu on metabolism. So there, that is why there is Guru Santarpanam, means Guru by digestion, Guru by metabolism. Is Guru by digestion and Guru also by metabolism.
What is the maximum amount of ghee is recommended for diabetes, and what is the quantity in pre-diabetes stage?
Pre-diabetes stage we don't give ghee.
First was pre-diabetes, and then in developing diabetes.
Ghee? Ghee we recommend only in Vata type of diabetes. And dosage is dependent on Agni. Because that is the key thing. All Guru Santarpana food and ghee, we must be very careful to give it according to the Agni of the person.
We need to be careful
with the Agni, because otherwise it will produce ama and produce problems. That is the only precaution. When you have to give ghee, you have to ensure Agni is strong, then you can give. If you want an indicative dosage, you can give from a range of 5 to 15 ml. But you have to fix based on the strength, the digestive strength of the individual.
Which oils and in which quantity you can replace
You mean
which oils can replace ghee?
Oh, oil for internal use? Yes, I mean there is the fact is oil and ghee is ghee. One cannot replace the other. And the second thing is that
that's the question.
Yeah. The second thing is that oils, body needs oil. So the problem is the way we use it. One is chemically processing the oil is the first danger. If we use freshly, prepared oil, natural, it may not last for long. Fresh oil, not really treated, then there is not much harm. So the daily requirement of fat should be met. Second thing is cooked oil. Try to avoid cooked, fried, repeatedly heated oil. Because according to Ayurveda, the human being is snehasara, means sustained by the sneha guna of the fat. It's very much needed for the body, but you have to ensure that the body is able to absorb it and not create ama out of it. So the principle is chemically not treated, unnecessarily cooking of oil to be avoided. You can add oil at the end of cooking rather than cook with oil, frying with oil, because they produce trans fats which are actually more dangerous in diabetes. But so Ayurveda says there are ways in which you can give oil to the body without creating damage. That is what we do.
And now at the end of our seminar, we would like to do a little ceremony and to present a certificate for everyone who attended this seminar. Some of you came especially from other cities, and there are many who were with us online. You will receive certificates by email from our technical support department, and today for those who are here, Dr. Ram will present it.